And the two most common screening tests are the one-step method and the two-step method. And both of them are going to use the oral glucose tolerance test, or OGTT, that you mentioned earlier. So the one-step method became the most common method around the world after the HAPO study. However, this method is not used in the US or Canada typically. So with the one-step method, you have to fast for at least 8 hours. You go in and have your blood drawn fasting to measure your fasting blood sugar level. You're then given a 75-gram glucose drink, and you have to consume that pretty quickly. And then your blood is drawn 1 and 2 hours after you've consumed the drink. So this is 3 blood draws. In contrast to that, the two-step method is what we commonly use in the United States and Canada. So this approach involves an initial screening OGTT, and if you test positive, then you'll have a follow-up diagnostic OGTT. So in the first step, you would drink a 50-gram glucola beverage, and you would have your blood drawn to measure your blood sugar 1 hour later. No fasting is required, and it's only 1 blood draw. Now, if your blood sugar levels are high, according to different cutoffs for the test, you might be scheduled then for a follow-up diagnostic test on a different day. And about 14 to 23% of people who drink that initial glucola drink end up needing the second diagnostic test. The second step involves using either a 75-gram or 100-gram glucose drink that you drink fairly quickly. And so this is more glucose than you did in the first step. And it does require that you fast beforehand. So you come in fasting for the test, you have your blood sugar levels drawn fasting, and then you drink the 75 or 100-gram drink, and then your blood is drawn to measure blood sugar at 1, 2, and 3 hours after drinking the glucose. So this involves 4 blood draws with the second step. So neither of these methods is perfect. They both have their pros and cons.